Hi, I'm Kimberly Treon. I'm going to be doing the vital signs skills video. So I'm going to enter my patient's room. I'm going to close the door, the curtain to ensure patient privacy. I'm going to perform hand hygiene, and I'm going to introduce myself to my patient. Hi, sir. I'm Kim. I will be your nurse today. Will you verify your name and your date of birth?
My name is Justin Treon. My date of birth is January 25th, 86.
Fantastic. So I ensured it was the right patient with 2 patient identifiers. Mr. Treon, is it okay if I take a baseline set of vital signs today?
Yes.
Fantastic. So first, I'm going to ensure that I have all of my supplies. I have my stethoscope, my blood pressure cuff, and my watch. We're going to start by taking a radial pulse. So we're going to feel for the rate, rhythm, and quality. The rate on initial palpation is not overly bradycardic or tachycardic. The rhythm is regular, and the quality is a +2 or normal, but I would note if it was weak, thready, or bounding. All right, give me a minute while I count. All right, so I counted his pulse for 30 seconds and I got 32 beats in that 30 seconds. So his pulse rate is 64 beats per minute, which is well within the adult range of 60 to 100 beats per minute. Additionally, I counted his respirations after I counted his pulse. I counted 7 breaths in 30 seconds, which would give him a respiratory rate of 14 breaths per minute, which again is well within the adult range of 12 to 20 breaths per minute. I assessed his depth and quality of breathing. He's got equal chest rise and fall with good tidal volume. Will you take a nice deep breath for me? All right, he's got good lung expansion. I don't hear any audible wheezes or any adventitious lung sounds on expiration. So I will now do my blood pressure. So I selected the appropriate size cuff for this patient. I'm going to feel for his brachial artery. All right. I'm going to ensure that I line up my left arm arrow with my brachial artery. Mr. Treon, what is your normal blood pressure?
120/80.
Okay, so I'm going to take that estimated systolic of 120. I'm going to add 30 millimeters of mercury to that to give me a indicator of what to pump my cuff up to. So I'll pump it up to 150 millimeters of mercury initially. I'm going to slowly release the pressure and let the needle drop about 2 to 3 millimeters of mercury per second. I'm going to listen for the first quarter cough sound, which will give me my systolic, and then I will continue to listen until the 5th quarter cough sound, which will give me my diastolic. I'm going to continue listening for about 10 to 20 millimeters of mercury after that last sound, just to ensure that I did, in fact, have the accurate read for that diastolic. I'm going to ensure that my tubing is not touching my stethoscope tubing. All right, so his blood pressure was 116 over 78, which is within the normal adult range of a systolic between 100 and 120 and a diastolic between 60 and 80. I will go chart my findings. Mr. Trion, do you have any questions, comments, or concerns before I go chart? Fantastic. I'm going to perform hand hygiene on the way out and go document my vitals.